Today we are going to discuss about the questions frequently asked in the Google. So, first of all, I am Dr. Santhi Vardhani, proctologist, general surgeon and colorectal surgeon. The first question is, what is the first stage of piles? First stage is nothing but it is, there won't be any visible piles at all, but there will be problem while defecating and also occasionally some bleeding. These are called first stage. So in the second stage there are visible piles, in the third stage the piles will come out, and in the fourth stage the piles will stay outside only, it won't go inside. And grade 1 and grade 2, the first stage and the second stage doesn't require any surgery. Usually it is a lifestyle modification and dietary modification. Let us go to the second question. What are the common symptoms of piles? Some pain, because if the piles are over distended, lumen, that is the cavity, anal canal, so it is like a pipe. Anal canal is nothing but a pipe. In that pipe the vascular cushions will be there. Whenever we are opening, they will open and it will facilitate the way. If they are hypertrophied, that means symptomatic, then the size of the pile will be increased and it obstructs the way to let out the stool. Then patient has to give more pressure to let out the stool. That pressure itself can cause some pain, some burning, some discomfort, and that hypertrophied vascular cushion, because of the pressure, there will be rupture and bleeding. So at times, no symptoms, no problem at all, even though they reach to grade 4 also, the symptomatic piles are more good than the asymptomatic piles, because if the symptoms are not there, the piles will grow more and more and they will reach to grade 4, and the patient will land up with sudden bleeding and loss of hemoglobin like 3-4 grams and emergency. Except these, few other symptoms are also there. Anal itching. Itching is also one of the problems. Pruritus, it is called pruritus in the medical language. Whenever any anal problem, better to see a surgeon or a proctologist. The next question is, can piles bleed? Many people ask me in my OPD also. Grade 4 piles also sometimes they won't bleed. So piles can be divided as bleeding piles and non-bleeding piles. So every person thinks that once the piles are there, there will be a bleeding. No. Sometimes the piles will be there without bleeding also. So usually internal piles are bleeding piles and the external piles are non-bleeding, and they cause more of pain and discomfort, cannot able to sit for prolonged period on the chair. These are the symptoms. So we can divide the piles into as a position: internal piles, external piles, interno-external piles. The symptomatic external piles, always it is a troublesome. Even though there is no bleeding, the symptomatic piles are definitely should be addressed. The next question, can piles cause complications? So what we discussed already, the complications. So the external piles, they are like a balls, spongy balls. Once they are disturbed, they will come out and it causes that sponginess will be lost and it will become hard. Once it is hard means the blood is accumulating over there and it is forming like a clot. So the normal liquid blood, when it turns into a hard clot, it causes lot of pain. So that is once the clot is increasing day by day, then it becomes ulcerated, because you think that some balloon is there. When you are pumping a lot of air into the balloon, it will distend more and more, and at one time it will burst. So the same thing will happen in the pile also. Because of the distension of the blood clots, the pile will increase, but there is no scope to burst. Then the size, that much size, will cause lot of pain in the patients. They can't even walk also because of that swollen balls over that area. Because of this, there will be ulceration, infection, and this portocaval anastomosis, that is called some portal circulation will be there and caval circulation will be there. This circulation will go to the systemic circulation into the body, which can cause a lot of sepsis. Patient can land up with infection. So whenever it is infected, thrombosed, ulcerated, it needs to be addressed immediately. Don't delay it. But one thing many people will ask us, is the hemorrhoids can transform into a cancer? No, it cannot cause cancer. And how long do piles last? Usually once the piles are there, grade 1 and grade 2 can be reversed with the medical management along with lifestyle and the food changes. But once grade 3 and 4 are there, it cannot be changed and it cannot be reversed. It will be there. At least we have to try that. If grade 3 is there, we have to prevent to going into grade 4. Every human being is having piles, but only hypertrophied symptomatic piles are diseased one. Otherwise, every human being is having piles. They are acting like a gatekeepers at the anal canal. Our continence, that is withholding capacity, major contribution by the piles only. The next question, can piles go away on their own? In one way, genetical preposition is also there. In few families, genetically the piles will run. There are many theories about it, and weakness of the musculature, a lot of collagen issues, many things are there. But once the piles are there, grade 1 usually it will go away. Grade 2 also sometimes go away if you change your lifestyle and the food habits. If you are not changing, it won't go. Okay, but every 1 year, 2 years, it will come and it will go like a fever in few patients. If it is coming like once in 2-3 years, there is no need of any bothering. Just be cautious about the food. If it is regularly bothering, then it is definitely needed doctor consultation, because it is not a cancer. It is a benign symptom. It is a swollen pile. It is easy to tackle if the patient comes in time to present to the doctor. And the last question is, what should I avoid with piles? First, patient himself has to analyze what might be the cause for this to occur. So once you analyze, automatically the solution will be there. But one thing is, in few people who are doing gym, nowadays fitness exercises only up to certain extent, not more than, not beyond. In few people already having grade 1 and grade 2 piles, if they are lifting 50 kgs of weights, usually the pressure is mainly at the anus. By that, the anal cushions will come out. Even though they are not symptomatic, the cushions will come out. So please take care while doing gym. How much weights you are capable of doing. If you are not capable, don't strain yourself to do more weightliftings. And multiple pregnancy is also one of the cause, which can cause, because of the baby head compressing over the pelvis, the piles will come out. Plenty of fruits, salads, that is fiber food intake is very much needed. And not only the fiber, over fiber also it is not good. Balanced diet. What is balanced diet? It should contain everything. Carbohydrate, protein, fat, everything. Nowadays many people are coming. You should maintain some timings for the food and also some timing for the sleep. The sleep pattern is very much important for our digestion. If you are not sleeping properly on bed, then the digestion process won't occur in a proper way. Our body requires a lot of water. So always make sure that you are drinking good amount of water. You are rehydrating your body. After all these, one small exercise is also needed to make yourself fit. So these are the questions. I think I answered the frequently answered questions in the multiple Google apps. Yashoda Hospital summarized the questions for me and they have given me. So I answered. I think many of you got good answers for your questions. If anything is there, you can see us at any time. Yashoda Secunderabad, Dr. Santhi Vardhani. Thank you.